Hey, what's going on? There is an old saying that says, if you aim for nothing, you hit it every single time, right? So today I want to have a conversation all about defining your audience for your urgent care clinic or your medical practice. And I cannot overstate the importance of making sure that you know exactly who you're trying to talk to in your marketing messages. So today I'm going to give you 5 different categories for you to sit down with, grab a pen, grab a paper, grab your iPad and Apple Pencil, and put some pen to paper to figure out who it is that you're trying to market to. That could be digitally, that could be grassroots, that could be traditional marketing. We just want to make sure that if you're going to say something, you're saying it to the people who actually care about what you have to say. So let's get right into it. The first thing that I want you to think about is the demographic factors of who you're going to talk about. How old are they? What is their gender? What is their income level? So are you talking to a 40-year-old mother of 3 that is a high income earner? Are you talking to a single dad that may be Hispanic, that may be a lower income level? Are you talking, think about who it is that you're trying to talk to. Are you talking to a young adult that may be in college or maybe out for the first time in their new job? And they may not make a huge income, but they definitely care about their health. You need to identify, how old are they? What do they look like? Where do they hang out? What is their gender? What is their income? Where do they like to visit? Where is your clinic located, and who are the people around that clinic? Now, speaking of location, that comes to number 2. Understanding where you're located is going to be incremental in how you go to market. Here in the area that we live in, there are areas that are very high income level, and there are people that are very low income level, and then there's everything in between. But if I go to certain areas where it is your standard middle class area, I am not going to talk to them to the same way of a doctor that has a stay-at-home wife with 3 kids in private school. That's just not the same conversation. And there's nothing wrong with either one of those, but understanding that you're talking to them in the location they're in, making sure that you understand where you are. You only really want to target the people in a 5 to 7 mile radius around your clinic. So you want to make sure that you understand the neighborhoods that you're going to be serving so that you're talking to the people that are in those neighborhoods. So focus on the demographic that's around there. Most patients are going to come from within a specific radius. We talked about that. And so you're going to want to have a marketing avenue that's going to target those locations, not just this broad scope marketing. So make sure that you have your location well defined, and then analyze the population. What kind of businesses are there? What kind of school systems are there? What kind of fast food chains, what kind of parks, what is going on in that location, where you can start thinking about how to market to those people. A quick example of this would be a client that we've done business with in the past, that they put a hang tag inside kids' car rider lines. So if a parent's going to pick up their kid, on the front it's got the number of their kid, but on the back it's an advertisement for a clinic. So that parent has to look at that ad every single day, and that's a good grassroots marketing. They understand the school system that they're in. Maybe these school systems have kids that get sick, so they wanted to make sure that they marketed to them. So understanding the location of the school systems and how to get into those. The psychographic, like, what are these people thinking about? How do they feel about health? Do they care about it as an afterthought, or are they out walking in parks? Are they out exercising all the time? These behavior patterns and these health attitudes, these are huge ways for you to be able to talk to and market. It's not just their age and gender. It's how do they approach their healthcare in the first place? And this is a huge one. We want to make sure that you understand is going to be, how are they paying for their healthcare needs today? All right. If you're going to open up a clinic and your goal is to be cash only, you're probably not going to market to the people that have great health insurance. Okay. If you open up in a market where people are always going to be on Blue Cross Blue Shield or Aetna or some other form of healthcare through their employer or self-employed, probably a cash pay, having that as an option is great, but making sure that you're not marketing to them so much as you're marketing to the people, hey, come in, get healthy, get well, and get out, and we'll take your insurance and we're going to bill you right. But understanding how people are paying for their healthcare is going to be huge. Now, this is kind of a bonus, all right? But one of the things that I absolutely think that you could do and be successful in identifying your demographic is look for the other clinics, the other healthcare clinics around you, and figure out what their marketing looks like. I am not saying copy it. What I am saying is look at it and see, does this resonate? Does this not resonate? One of the best marketing strategies I've ever had is to say, I don't want to be like them, so I'm not going to do what they're doing. But if they've already made those mistakes, you don't have to go through those mine holes already. They've already done it for you. But these are the things that we wanted to go through. So make sure that you have a full understanding of your demographic factors, your location, your psychographics, your payer sources, and then do a good deep dive on your competitors to make sure that you are either doing things good, better, or different than them. Essentially, good, better, or different than what they're doing. These are the type of things that are going to help you understand who you're talking to, how to talk to them, when to talk to them, and the best way for them to receive that information. Finally, find out where they're hanging out. Here's what I mean. If you're going to have a digital presence, you already know that you're going to have a Google presence, but are they on TikTok? Are they on Facebook or Instagram? Do they like talk radio? Do they like Christian radio? Do they like PBS or public broadcast? Where are they? And talk to them where they are. That is the best advice that I can give you. I know you'll crush it. Use these tips, put them into application, define exactly what the person that you want to talk to looks like, hangs out, what they feel, all the different things about this person, and then start talking to just that person, and all the rest will come to your clinic. I hope this is helpful. Let us know in the comments if you have any questions. All right.